Dr. Jessica Nash is Associate Medical Director of Children's National Anacostia in Washington, D.C. She discusses the benefits and challenges of breastfeeding.
I think oftentimes we are just thinking of breastfeeding for infant nutrition, but one of the things that we know why breastfeeding is the preferred choice for feeding infants is that it has many different benefits, not only for the infant, but also the mother too. So one of the great things to think about is that breast milk and its components, meaning the nutrients, the vitamins, and the immune and antibody factors that breast milk has, that cannot be replicated in formula, in infant formulas, is that those antibodies are important in protecting infants from things like GI, diarrheal illnesses. It also decreases the incidence of lower respiratory tract infections, so things like pneumonia. There are some things that have shown increased IQ. So it helps with the brain development, and these are factors that cannot necessarily be found in formula. There are very few reasons why mothers cannot breastfeed, but there are some indications where mothers may choose medically why they can't breastfeed. And some of the ones that we tend to think about mostly are mothers who may be using illicit drugs. So if a mother is using substances like opioids or substances like cocaine, some of these illicit drugs, we may recommend a mother not to breastfeed. There are some relative risks, so things like HIV, which we know now over the last couple of years, depending on where you are and depending on the risks, that is not what we call a complete contraindication, meaning that a mother can't breastfeed if she has HIV. But there are certain reasons why a mother may need not to breastfeed. Oftentimes, some moms say, I don't have enough milk, and so they turn to things like donor milk, which is still we're having some difficulty making sure that donor milk is available for all people who need it. As of right now, in places like the US, donor milk is for usually preterm infants in the hospital. But some moms have taken it upon themselves because they want to support others or they have huge milk supply. So they offer milk to other moms. And so the one issue to think about with donor milk is it safe? Has it been tested? And can it be given to another infant? In some instances, some people are donating to their sister or they're donating to a colleague. And of course, there's always an inherent risk